Did you know that your body could be giving you silent signs of heart failure every single day? This condition affects over 60 million people worldwide, yet many cases remain undiagnosed until the late stages. The reason is simple. The early symptoms often feel vague or harmless, so people brush them off. But ignoring these red flags can be dangerous. Heart failure does not develop overnight. It builds gradually, and your body gives you signals along the way. Things like constant fatigue, swelling in the ankles, or shortness of breath during normal activities may all be early warnings. The good news is that identifying these signs early can slow down progression and give you more control over your health. Today, we will break down 7 subtle signs you should never ignore. Recognizing them could protect not just your heart, but your independence and quality of life. What is heart failure? It is often misunderstood. Despite its name, it does not mean that the heart suddenly stops beating. Instead, it means the heart is too weak or too stiff to pump blood effectively throughout the body. When blood flow is reduced, organs and tissues do not get enough oxygen, which leads to tiredness, breathlessness, and swelling. This condition is especially tricky because its symptoms often overlap with aging, stress, or even being just out of shape. Many older adults assume feeling weaker is simply part of getting older, but in reality, it could be an early warning of something serious. The silver lining is that when caught early, heart failure can often be managed with lifestyle changes, medication, or therapies that improve quality of life. That is why knowing the signs and acting quickly can make all the difference. Shortness of breath. One of the most common early signs of heart failure is shortness of breath, also called dyspnea. At first, it may show up only during physical activity, like climbing stairs or walking a short distance. Over time, however, it can happen even when you are resting or lying flat in bed. Some people notice they need extra pillows to sleep comfortably because breathing feels easier in a more upright position. The reason behind this symptom is fluid buildup in the lungs. When the heart is too weak to pump blood effectively, it causes pressure to rise in the blood vessels that connect to the lungs. This pressure pushes fluid into the air sacs, making it harder for oxygen to move into the blood. The result is a feeling of heaviness, tightness, or inability to catch your breath. Shortness of breath is often mistaken for asthma, aging, or being out of shape. In the context of heart failure, it is a serious warning. Ignoring it can allow fluid congestion to worsen, leading to more severe breathing problems. If you notice that routine activities suddenly leave you winded, or if you wake up at night gasping for air, it is important to seek medical advice. Early treatment can help manage fluid levels, reduce pressure on the lungs, and restore better breathing. Dyspnea is not just uncomfortable. It is your body's signal that the heart is struggling to keep up. Persistent fatigue. Another subtle yet powerful sign of heart failure is constant fatigue. This is not the normal tiredness you feel after a long day, but an overwhelming sense of exhaustion that lingers even after proper rest. People often describe it as having no energy for everyday activities such as cooking, walking, or even getting dressed. This persistent fatigue is caused by the heart's reduced ability to pump oxygen-rich blood throughout the body. When circulation is compromised, muscles and organs do not receive the oxygen and nutrients they need. The body reacts by diverting limited blood supply to vital organs like the brain and heart itself. As a result, the muscles and tissues are left with less oxygen, which makes even light tasks feel exhausting. Fatigue can also be worsened by disrupted sleep. Many individuals with heart failure wake up at night due to shortness of breath or frequent urination caused by fluid buildup. Poor sleep further drains energy levels, creating a cycle of tiredness. Unfortunately, many older adults dismiss constant fatigue as part of aging. However, when fatigue persists and interferes with daily life, It should not be ignored. It is often an early warning sign that the heart is under strain. With proper treatment, energy levels can improve significantly. Persistent fatigue is more than being tired. It is the body's way of signaling a deeper problem. Swelling in legs, ankles, or feet. Swelling in the lower body, particularly in the legs, ankles, or feet, is another common sign of early heart failure. This type of swelling is known as edema and occurs when fluid collects in the tissues. While it may start as mild puffiness at the end of the day, it can gradually worsen, making shoes feel tight or leaving visible marks when you press on the skin. The underlying reason is fluid retention. When the heart is not pumping effectively, blood flow slows down and backs up in the veins. This increased pressure forces fluid out of the blood vessels and into the surrounding tissues. Because of gravity, the swelling tends to appear in the lower parts of the body where fluid naturally pools, such as the feet, ankles, and legs. Edema is more than a cosmetic concern. If untreated, it can cause discomfort, reduced mobility, and even skin problems such as infections or ulcers. In advanced cases, fluid buildup can extend to the abdomen, making people feel bloated and heavy. Many older adults may confuse swelling with standing for too long or eating salty foods, both of which can also cause fluid retention. However, continuous or worsening swelling, especially when paired with shortness of breath or fatigue, is often linked to heart failure. Daily monitoring of swelling and sudden weight gain can help catch fluid buildup early. Lifestyle changes, medications, and reduced salt intake can all help manage edema. Swelling in the legs is not just about circulation. It is a visible sign that the heart is under stress. Rapid or irregular heartbeat. A rapid or irregular heartbeat, often felt as palpitations or a fluttering sensation in the chest, is another common sign of heart failure. Many people describe it as the heart racing or skipping beats, even when they are sitting still or not exerting themselves. While occasional palpitations can be harmless, frequent or persistent episodes should never be ignored. This happens because the heart is struggling to pump blood effectively. To compensate for its weakened pumping ability, the heart often beats faster or develops an irregular rhythm. This is the body's attempt to maintain enough blood flow to vital organs. However, the faster rhythm does not always translate into efficient pumping, and over time it can put even more strain on the heart muscle. An irregular heartbeat may also increase the risk of blood clots, which can lead to serious complications such as stroke. For seniors, these risks are especially concerning. In some cases, people may also feel dizziness, weakness, or chest discomfort, along with palpitations. It is important to track when these sensations occur. If your heart regularly feels like it is fluttering, pounding, or skipping, it is a signal that your cardiovascular system is under stress. Doctors can evaluate this with simple tests, such as an electrocardiogram, ECG, and recommend treatments that restore rhythm and reduce strain. Ignoring this symptom can allow damage to progress silently. On the other hand, identifying and treating it early helps protect both heart function and overall quality of life. Continuous cough or wheezing. A persistent cough or wheezing that does not go away may also point to early heart failure. Unlike a temporary cough from a cold or allergies, this cough often lingers and may even produce white or pink-tinged mucus. Many patients describe it as a nagging, dry cough that worsens when lying down. The cause is fluid buildup in the lungs. When the heart cannot pump efficiently, blood backs up into the vessels of the lungs. This extra pressure pushes fluid into the lung tissues and airways. As a result, the lungs become congested, and the body responds with coughing or wheezing as it tries to clear the excess fluid. The pink tinge in mucus happens because small amounts of blood may leak into the fluid due to pressure in the lungs. Wheezing can occur because the airways narrow when irritated by fluid, making breathing feel tight and noisy. Many older adults confuse this symptom with asthma, bronchitis, or lingering chest infections. However, when coughing is accompanied by shortness of breath, swelling in the legs, or fatigue, it often signals heart problems rather than lung disease alone. If untreated, fluid buildup in the lungs can lead to serious complications such as pulmonary edema, a life-threatening condition where breathing becomes extremely difficult. Recognizing a continuous cough as a potential warning sign of heart failure allows for early medical intervention. Treatments can include medication to remove excess fluid, reduce lung congestion, and improve heart function. A lingering cough should never be dismissed. It may be one of the earliest ways the body tells you the heart is struggling. Increased nighttime urination. Frequent urination at night, known as nocturia, can also be an early symptom of heart failure. While occasional nighttime bathroom trips are common with age, a sudden increase may point to underlying cardiovascular issues. The reason lies in how the body manages fluid. During the day, when you are upright and active, excess fluid tends to collect in the legs and ankles due to gravity. When you lie down at night, this fluid returns to the bloodstream and is filtered by the kidneys. As a result, the kidneys produce more urine, leading to repeated trips to the bathroom during sleep. In heart failure, the weakened heart cannot circulate fluid efficiently. This causes more fluid retention in the body overall, which then shifts when lying down. The kidneys, sensing the excess, go into overdrive to remove it. The end result is frequent nighttime urination that disrupts sleep and contributes to fatigue the next day. Nocturia is often dismissed as part of aging or linked to prostate or bladder problems, but in many cases it can be a sign of poor heart function. Combined with other symptoms like swelling in the ankles, shortness of breath, or fatigue, it provides a clearer picture of developing heart failure. Monitoring changes in bathroom habits is important. If you find yourself waking several times every night without another clear cause, it may be worth discussing with a doctor. Addressing nocturia not only improves sleep quality, but can also reveal heart issues before they become more serious. Difficulty concentrating or confusion. Heart failure does not only affect the body, it can also impact the brain, showing up as difficulty concentrating, forgetfulness, or even sudden episodes of confusion. Many people describe it as brain fog, where tasks that once felt easy suddenly take more effort and focus. The underlying cause is reduced blood flow and oxygen supply to the brain. When the heart cannot pump effectively, the brain receives less oxygen and fewer nutrients, which are essential for clear thinking and memory. Seniors may notice that they feel mentally slower, struggle to focus on conversations, or have trouble recalling information. Medications and disrupted sleep due to other heart failure symptoms can worsen this mental fatigue. In advanced cases, confusion may appear suddenly, especially when fluid buildup or oxygen levels in the body drop significantly. Cognitive changes are often overlooked or attributed to aging alone. However, when they occur alongside other symptoms, such as fatigue, swelling, or shortness of breath, they may signal that the heart is not supplying the brain with what it needs. Addressing the root cause can improve mental clarity. Treatments that strengthen heart function and improve circulation often help restore focus and reduce confusion. Lifestyle changes, such as balanced nutrition, regular physical activity, and proper rest, also support brain health. Difficulty concentrating should never be dismissed as simply getting older. The brain is one of the first organs to respond when the heart struggles. Paying attention to mental changes is just as important as monitoring physical symptoms. Recognizing this link can lead to earlier treatment and a better quality of life. It's important to remember that the symptoms we have discussed may overlap with other health conditions, such as asthma, diabetes, or even normal aging. However, when several of these signs appear together or worsen over time, they could point to the early stages of heart failure. Ignoring these signals may delay proper treatment and increase health risks. Always listen to your body, and if you experience persistent symptoms, don't try to self-diagnose or rely solely on home remedies. Consult your doctor promptly for professional evaluation and guidance. Early medical attention can make all the difference in protecting your heart. Your health deserves your full attention. If you found this video helpful, make sure to like it, share it with your loved ones, and subscribe to our channel. We bring you simple, science-backed health insights that can save lives. Stay informed, stay healthy, and take care of your heart.